I'm Dr. Clemmons with Zoot, and we're going to be talking about arthritis management in cats and dogs. People will, with their older cats and dogs, will reference slowing down or say, oh, they're just getting old, when in reality it's changes in musculoskeletal systems that can be addressed, that can give them quality of life. And a lot of times we'll be doing just an annual exam and they reference going on shorter walks, or that the dog wants to just go lay down on their bed when they used to being next to the couch with the owner, or they don't greet them at the door anymore, or that they have an extra active weekend and it seems like they're even lethargic for a day or two afterwards. So it's almost an incidental finding sometimes, and then so you get those kind of bits of information during the exam, and then it can correlate to potentially findings when you actually assess them musculoskeletally within the exam. Cats are a little different. They can also be grouchy, like used to being picked up, no longer want to be picked up, having accidents outside the box, inappropriately eliminating, and it can be because it's literally uncomfortable for them to step over that litter box edge, and they'll find out that the cat is not eating, and it's because they're physically hesitant to jump up to that surface. Arthritis or degenerative changes in the joints might be the source of the problem, and you can have younger animals as well have issue that if they've had a trauma. I mean, like I personally had a dog that broke a leg as a puppy that had arthritis in the associated joint as he got older, so that required management. So sometimes those bits require diagnostics first, so things like x-rays. A lot of times the exam will tell you quite a bit. There's range of motion things you can do. They'll tense up, they'll actually vocalize if there's spots that are painful. And animals that have been dealing with it for a while will even develop muscle atrophy and certain body posture changes that can go with weakness of the associated supporting muscle structures or avoidance of using something that hurts. We often recommend a multimodal approach where we use things such as supplements, medications, and regulated exercise or physical therapy. As far as managing these conditions in these pets, there's different classes of products, and certain ones like glucosamine products, there's oral, there's injectable, there's even a lot of additives in diets these days, so there's joint-related diets. The theory behind the medications is to keep the pets as mobile and as comfortable as possible so that exercise and family activities and all those things can continue. Because while there might be a joint that's painful, all the supporting muscles and ligaments and tendons all still need that regular use and exercise to be supportive to that joint.